uh, prevention for seniors. I'm not sure if most of you are seniors yourselves or if you have family members that you're gathering information for, but welcome. All right. Today, what you're going to be learning is to identify external and internal factors attributing to falls, what you can do to prevent falls for yourself or your loved ones, as well as how to get up properly after a fall. All right, we're going to get into statistics for seniors who falls. That on average, 1 out of 4 seniors age 65 or plus will fall at least once a year. Women fall more than frequently than men. I think that's due to osteoporosis and other factors that contribute to the different sexes and aging process. More than 50 billion spent, actually update that. I believe it was $10.3 billion are spent on hospitals alone from falls, and all the tests and everything in the hospital that gets done when a senior falls. So spent directly in medical costs for seniors falls. Every 20 minutes, a senior dies from a fall. Actually, from what I've seen, a lot of falls that do happen that does result in a death in the hospital. It actually becomes an investigation, but a lot of people do come in, and unfortunately, due to age and types of falls and complications that happen, it actually is quite a big deal in the for seniors, and that is a true statistic. Every 13 seconds, a senior is treated in an emergency room for falls. 95% of all hip fractures are caused by falls, and that is another experience of mine that I have, is a lot of hips and falls do tend to, because of the age group and because of the factors along with the bones and the brittleness of it, that they have a bone. Not always just hip fractures, but a lot of bones tend to break for seniors from falls. 87% of all fractures occur among people age 65 and plus. And falls is the leading cause of fatal and non-fatal injuries among seniors. 1 out of 3 seniors who live independently in their homes will experience a major fall each year. And I looked at statistics, so 20 to 30% of seniors, it is bumped up, fall every single year as well. So that is because of the fact that most seniors are tending to live independently and living longer, as well as if they don't have proper supports in place, falls do tend to happen, but we'll go into that a little bit more into the presentation. All right, a little bit of did you know? Falls is the leading cause of fatal and non-fatal injuries for seniors. Oh, I think we went over women fall more than men and are more likely to have osteoporosis, which weakens the bones and makes them more likely to break. Every year, over 50% of seniors, actually that's now up to 80% of seniors are aged 80 and above, have an above experience of fall. Most falls happen in the bathroom because of the slippery, wet floor, or when you're having a shower, the shower door or the curtain isn't necessarily closed properly, and water gets on the floor, as well as the slip mat. If you don't have a slip mat in your shower or chair, getting in and out of the tub, if it's not easy, or if the floor is, you don't have a mat outside of the bathtub, falls tend to happen in the bathroom. And sometimes it's rushing to get to the bathroom from bed and not having a nightlight and trying to get for the bathroom. And if you urinate on the floor, or don't have the proper footwear, any slippers, non-slip slippers, tends to happen in the bathroom. Falls are now actually 65 instead of 40% of admissions to nursing homes or into the hospital. External factors that might lead to a fall: 4 or more medications, which we call polypharmacy, poor lighting, unstable chairs, steep stairs, loose carpets, lack of bathroom safety equipment, as well as sometimes pets. So cats can also be another, because cats tend to be a little more sneaky. And I would recommend that you would put a bell on your cat's collar just so that you can hear them, because they tend to be a tripping hazard as well, which is an external factor. Internal factors that might lead to a fall: weakness and tightness in the limbs and muscles. As we age, we all tend to become a little more, our bones and joints tend to become a little more weaker, and not exercising as much, sometimes due to pain. Low blood pressure, which also when you try to get up too fast, some people, their blood pressure drops really quickly, which actually causes them to be dizzy, and they tend to be at higher risk of falls. Muscular degeneration, peripheral neuropathy, neurological diseases, so any strokes, clots, brain issues, diabetes, osteoarthritis of the knees and hips, and osteoporosis. All right, we're going to talk about ways to prevent falls. I did mention one with putting a bell on your cat, but also talking to your doctor or pharmacist once a year about your medications, making sure that they don't contradict each other, making sure that that you're only on medications that you absolutely need to be, as well as talking to your doctor once a year, not only about your meds, but if you have any recent hearing loss, change in vision, weakness in the legs or feet, or if you've fallen in the past year. Because usually those that have fallen in the past year have a tendency to be afraid to fall again and are afraid to get up and walk on their own or need assistance. And then because of the fear of falling, some don't exercise and get the strength back up or walk more. It actually leads themselves to being weaker in the muscles, but then therefore it tends to lead to falls. Okay. How to prevent falls? So prevention. The floppy slippers or a long house robe can actually be a challenge, especially for seniors, because they tend to shuffle their feet instead of picking them up. So sometimes that makes it harder for them to get around properly. So wearing good footwear, non-slip slippers, and shortening the ropes just a little bit actually helps prevent them tripping over their feet. Any trouble reaching overhead. And now another solution besides keeping things on lower shelves is also having possibly a reacher, or as well as, if comfortable enough, a good sturdy stepping stool. So probably best to leave it or keep it in the lower shelf or somewhere where it's within reach for them, so they're not up and having to get up on that sturdy or unsturdy ladder or the chair, because some people have family members or have had neighbors, loved ones that sometimes decide to stand on a chair or get up to a certain level that is not reaching on, not a safe device. So a challenge again is trouble reaching items on the floor. So bending down as well also can cause, especially if they are not steady on their feet or if they're already using a walker or a cane. Trying to bend down is also throw them off balance and can cause falls as well. So keeping objects near something sturdy or using the cloth, as I had mentioned earlier, for stuff that's on a higher reaching, as well as for lower reaching items. Another challenge that we hear is trouble entering or exiting bathtubs, which is why the bathroom tends to be where they have most of their falls. So when you can add grab bars, having a seat in the bathtub. There is different sizes of chairs that are meant specifically for the shower or the bathtub that they can sit down on, so they can actually conserve their energy more, and that they're able to just sit down instead of being on their feet, which can be unsteady, especially if they have a walker or a cane, usually when they're walking, as well as I said, non-slip mats, either just outside and one inside the shower, so that they are, and handheld shower heads, so having them be able to reach it down to themselves instead of having it over their head does help. In that way they can get areas that you might not be able to get if they are sitting down. Trouble getting in and out of the chair. Oh, and just to add a bit about the bathtub as well. I know that there's different companies that you can have it so that the side of the tub can be removed or lowered so that it's easier for them to step in, or even having a walk-in shower. It would be helpful as well, without a little ramp or a little piece that you would have to step over. Sorry, the next challenge is trouble getting in and out of the chair. The solution is avoid sitting in a lower furniture. So having furniture that comes up to, I believe it's just behind the knee, like the end of the top of your calf and the kneecap and the back of the knee, having furniture up at that level and then sitting down. There is other furniture now that can actually raise you. I know that I've seen the individual chairs that will actually get you from the sitting position all the way up to the standing position. If that is another option for those that are at high risk for falling, and if it is harder for them to get out of furniture, there is that option out there now, as well as just making sure that even if it is putting a couple of cushions on top of the original cushion, so it's easier for people to be able to get up from the sitting position and not sitting as low. There are different ways to avoid having the furniture really low, so they're not sinking into the couch or chair. And the last challenge is trouble walking without assistance. So that's where we consider possibly having a four-wheel walker, consider a cane, or even any other device that helps them. If it means having proper railings on the outside or going up and down stairs, making sure they're sturdy and making sure they're connected or firm to the wall, so that if they need to hold those going up and down stairs as well, that as well helps. So that is making your home safer. So no throw rugs. There are rugs that don't have the rubber matting at the bottom, which tend to be a lot more slip and slide on aluminum floors or the hardwood floors, and those are the rugs that we're talking about, the no throw rugs. There are certain rugs you can get with a rubber mat where they actually stick in place and don't slide. But if you're afraid of your loved one or yourself falling at all, it'd be probably best not to have any extra rugs that you could trip on or that would slide out from underneath your feet. as I said, adding to the handrails to stairs, making sure that they're sturdy inside and outside of the home and that they're not falling apart or loose, just so that you can grab them and hold on to them as you're going up and down stairs for your loved ones. Clearing all pathways. That means anything from snow to shoes on the floor, pets, sports gear, any type of things that could be in the way for a loved one to be able to walk. It's clearing the path and keeping them clear. Improving lighting, as I mentioned earlier, sometimes when people are trying to get to the bathroom due to urgency, they tend to get out of bed quickly and they might trip over their own slippers if you don't get that on properly, or trip going into the bathroom. So proper night lights, maybe in the bedroom and in the bathroom, or there is other solutions of having maybe possibly a mode in the bedroom instead of having to run all the way to the washroom as well. So just proper lighting, making sure that light bulbs changed, and even in areas that aren't just the bathroom and bedroom, having little night lights or side table lights and multiple other lights inside the house to have good lighting, as well as keeping emergency supplies in each room. Maybe that will be if they're hungry, or if they hungry, or just having extra water inside the room and extra supplies, those emergency cases. So now we're going to go on to talk about if you do fall yourself. So it's, don't panic, try to remain calm, take deep breaths. I understand that you're probably feeling sore, especially on the fall. I know a good chunk of us, you brace yourself and can end up slamming really hard onto the floor depending on which way you do fall. Don't try to get up if you feel you've injured yourself. And if you've hurt yourself, use an emergency alarm, or call 911 if possible, if you have a phone nearby. I know some seniors tend to have the necklaces now that you can press if you have fallen down, as well as move to a soft surface. So if you did fall on one of the harder surfaces, if possible, move to a softer surface. Keep your arms and legs moving. Keep yourself warm until help arrives, because our bodies tend to go actually into shock. That's why we ask if you can find a blanket or a pillow or something to keep yourself warm, as well as keep yourself hydrated. So that way you can help prevent more injuries. If you aren't hurt, roll over onto your stomach, get to your hands and knees, crawl to stable furniture if at all possible. Place both hands on the surface. Use the strong legs or stronger leg, depending on if you've fallen on your one hip, if you've fallen on your bum. Lean forward and push yourself up, and slowly turn and sit. You can lower your fall risk as soon as next week. Nurse next door to perform a free risk assessment and home safety inspections. Just so you know, we are available to do that. And I forgot to add that some of the information I actually found, and I will add it into the slides as you can see here, that the hospitalizations throughout the years, most of them are at home compared to residential care. On the risks of over the years, it tends to go and just increases. I believe it's closer to 7 thousand now from 2019 to 2020. The at-home falls has increased. And that's just a little more statistics. And I will pass it on to Ralph and answer any questions you may have at this time.